And so I know looking at your x-rays, we do have like that hunching going over here. Deep breath. Let it go. Dropping the shoulders. There you are.
It does feel so much better right now.
Yeah.
Yeah.
I
Thank
love
you.
that, yeah. There it is.
Hey, yo.
So real quick, right before we start, I noticed that we have some reddening going on.
That's because of the heating pad.
Oh, really?
This is because I spend 24/7 on the heating pad because of, that's the only time it doesn't hurt.
When you're having the pain, can you show me where you feel it the most?
Right here.
Right in this area, right over here. Okay. And so it's been a while that you've had this discomfort right in here.
Yeah.
Okay. Now, when it started, you said it's been about 5 years?
Oh, yeah, at least.
At
Yeah.
least. Okay. And so I know looking at your x-rays, we do have like that hunching going over here, and this seems to be the area that you'll notice that, like, remember when I told you it kind of slips back a little bit
Mm-hmm.
and then it arches?
Yeah.
This is definitely going to be the area. So let's take a look and see what's going on. Oh, wow. Okay. So we definitely got some pressure right up here. So that needle just kind of ticks right at the base of your neck right here. So, yeah, right
When my
there.
neck hurts, that's right where it is, and it's the same kind of pain
Ooh.
that I'm having in my shoulder blades right now.
Mm-hmm.
That's sort of irradiating.
Okay. Let me see. Yeah, right there. So we're definitely seeing some inflammation, right? Oh, you can even feel like a little dip right in here too. So I think this is going to be the area that we're going to focus on a lot. But let's take a look at the rest of the spine here. Yeah, right there. All right, we got some things to look at here. Okay, so here, I'm going to start from the bottom. We're going to work our way up here, and then we're going to see what's happening up on top, okay? So the first thing is first, I'm going to push in right into the spine. So this is your L5, so right there.
Uh-huh.
And then 4, 5 is right there, okay. All right, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So here is T10, 11, 12, not too bad, 11, 10, which is most tender here, 10, 11, 12, 10, 11, 12. Any pain? Which is the worst? 10?
That one.
Okay, yeah. We
You
got
didn't
it.
say there'd be math, so.
Yes. It's like the when you go to the eye doctor.
Eye doctor.
Yeah.
I was just thinking, 1,
Yeah.
2,
1,
1,
2,
I don't
3,
know.
4.
They're
Here-
both blurry. I don't know.
Here's T4, T5, 4,
5.
5,
Yeah.
10, and then we got this guy right here, 6, 7. Yeah, so here's your C6,
Mhm.
C7, 6,
Yeah,
right
6.
there. Okay. 6, 5, 10, and then your L5 down below. We got some work to do.
Uh-huh.
You ready?
Okay.
Okay.
Bring it.
Yes.
Bring it on. I'm ready for it.
You're going to go ahead and relax that arm down. There you go. Perfect. Just like that. Now, we're going to go ahead and get to the C6, and we're going to give this a little bit of a push here. Relax the hands down just a little bit more. Right there, up onto the left. Right there's good. Both hands there.
Yeah.
Perfect. And all you got to do is just relax. Take it easy. Go on a little bit of a mental vacation if you like.
Mm-hmm.
There you go. Right there's perfect. And I'm just going to a little bit of a push right there, okay? Relax. Chin up a little higher. Up a little bit up. There it is. Good job.
Stars.
Stars.
Pretty.
Let's give just a little bit of a push. Sometimes this can be just a little uncomfortable. So when I push on this, we're going to go nice and easy. We don't need a huge clunk or pop, but we sometimes will get some of that movement, okay?
Okay.
So right on over here, this is your L5.
Just be careful of my hip, that's all I care
Oh,
about.
trust us, we are gonna be very careful of that. So we're gonna be really far from your hip, actually. We're gonna be right on your L5 here. Your hip is down here.
Mhm.
We're gonna be right over here, okay?
Okie dokie.
All right.
I trust you.
I appreciate that trust. I actually do. Thank you for being here.
Yeah.
You're going to just go ahead and take a deep breath and let that belly drop. And all you're going to feel, I'm going to give a little bit of a deeper push like that, okay?
Mhm.
All right. And then deep breath again. Let that go. There you are. Nice and easy. Okay. Now we've got this mid back and this upper back, okay?
Mhm.
So, 1, 2, 3, 4, 5, 6, 7, 8, 9, and then 10 right over here, 12. Alright, so this guy, it can be just a little sore because I know it's pretty tender in here. But when we get that adjustment, if we can get some movement, it's going to start feeling a lot better, okay?
Mhm.
Alright, and then deep breath. Let that go. Dropping those shoulders. Nice and easy on that. We got one more for you. You doing okay?
Mhm.
All right. 1, 2,
Yep.
4, and then 5. Deep breath. Let it go. Dropping those shoulders. There you are. How you doing?
Good,
All right.
really good,
How's it feeling in this area? Any difference yet?
really good.
Okay. Well, let's go ahead and just see. I want to see how this is looking here. All right. Good. Good. Okay. Oh, you're going to do just fine here. You're going to do just well. All right. So you should, as time goes on, we should start seeing that it becomes less and less painful, more and more tolerable, and much more relief will start to occur. So we did some good work today.
No, it feels, it does, I know a lot of it is mental also, but it does feel so much better right now.
Yeah.
Yeah,
I
thank
love
you.
that, yeah. So here's
Yeah.
what we did, right? So we did 3 things, actually 4 things for you. We did your L5. This is where it's stressed right here. Again, it's kind of pinching down on the back of that joint, okay? Now we also did your T10. This is this guy over here. So as it goes over to the left, it kind of kinks
Right.
back over to the center. So you're gonna see a lot of pressure in this area. We also did your T5, and this is in this area right over here. And then we did your C6. Again, this is where that joint, remember that disc, how it's thinned out a little bit? When that joint slips back, it's wearing out, so we're pushing that guy back where it needs to be, okay? So we did some good work today. It's gonna take some time for those joints to stabilize. So when we move those joints where they need to be, there's muscle memory, there's ligamentous memory, so it's gonna wanna pull back. So our job is trying to get that joint to heal in that proper position, so eventually it will stabilize and hold. So over time, we're going to give you some exercises, so then that way you can strengthen those muscles, strengthen the spine, so then that way we can get that longer, the holding of the position is much better, okay? But as of right now, what I would like to do is have you start walking and getting some movement in the body, and it can go between 10, 15 to 30 minutes, whatever you can handle.
Oh, okay.
Just getting some movement in the body, because the work starts in the office, it continues outside the office, okay? So walking is the best form of exercise. The second thing is usually I tell patients, you know, ice is the best friend. I know heat tends to be a little bit better for you. I want to hold off on the heat for a little bit
Okay.
so we can get your body to kind of recover from that.
So what about, we have a lovely jacuzzi at home, should I not go in that?
I would hold off for that a little
Okay.
bit. Let's see how your body responds
Okay.
to the adjustment and get some movement in there. And so we'll see how you do. But I definitely want to see if we can get you back in tomorrow so I can kind of reassess and see how
Right,
things do.
tomorrow's
Thursday.
Thursday, yeah, I think I am.
Okay, so let's do that. So then that way we can kind of get a better assessment of how you did after today's visit, okay? But otherwise, thank you for being here.
Okey doke.
Yeah, all right. Well, you're all
Thank you.
set. Have
Yeah.
a wonderful day.
Thank you so
And then
much.
we will see you
I'll
very
see you
soon.
tomorrow.
All right.